Chamomile tea has long been used, as a traditional folk remedy, for a wide range of health issues. Nowadays, researchers are increasingly exploring its effectiveness in managing illnesses, including cancer and diabetes. So far, research into the potency of chamomile tea has shown promise. However, studies vary, with some research proving clear benefits compared to alternative remedies, and others merely pointing to possible ones. For most people, chamomile tea is safe to try as a supplement to other treatments, but it should not replace mainstream medical treatments when people have serious illnesses. 1. Reducing menstrual pain. Several studies have linked chamomile tea to reduced severity of menstrual cramps. A 2010 study, for example, found that consuming chamomile tea for a month could reduce the pain of menstrual cramps. Women in the study also reported less anxiety and distress associated with period pain. 2. Treating diabetes and lowering blood sugar. Again, some studies have found that chamomile tea can lower blood sugar in people with diabetes. Research does not show that chamomile is a viable substitute for diabetes medications, but it may be a helpful supplement to existing treatments. Similarly, a 2008 study of rats found that consistent consumption of chamomile tea might prevent blood sugar from increasing. This effect reduces the long-term risk of diabetes complications, suggesting that chamomile could improve diabetes outcomes. 3. Slowing or preventing osteoporosis. Osteoporosis is the progressive loss of bone density. This loss increases the risk of broken bones and stooped posture. While anyone can develop osteoporosis, it is most common among postmenopausal women. This tendency may be due to the effects of estrogen. A 2004 study found that chamomile tea might have anti-estrogenic effects. It also helped promote bone density, but the study's authors caution that further research is needed to prove this apparent benefit. 4. Reducing inflammation. Inflammation is an immune system reaction to fight infection. Chamomile tea contains chemical compounds that may reduce inflammation. However, long-term inflammation is linked to a wide range of health problems, including hemorrhoids, gastrointestinal pain, arthritis, autoimmune disorders, and even depression. 5. Cancer treatment and prevention. Some studies suggest that chamomile tea may target cancer cells, or even prevent those cells from developing in the first place. However, research so far is inconclusive, and scientists say more work is needed to prove chamomile's anti-cancer claims. Also, most research has looked at clinical models in animals, not humans. A 2012 study compared the cancer-fighting powers of marigold and chamomile teas. Both were able to target cancer tumors selectively, but the effects of marigold tea were more potent. 6. Helping with sleep and relaxation. Chamomile tea is widely thought to help people relax and fall asleep. Few clinical trials have tested this, however. In one review of the current evidence, 10 of 12 cardiovascular patients are quoted as having fallen asleep shortly after consuming chamomile tea. A handful of other studies looking at clinical models also suggest that chamomile tea may help people relax.